I was a nurse for over 22 years in the field of psychiatry.
The supervisor said, "Oh, you're on the ECT rotation next week." And I said, "Oh, well, what do I do?"
The idea is that the shock will subdue the unwanted emotions. In fact, all it ended up with was brain damage.
I underwent electroshock therapy from the ages of 14 to 16.
And I can remember saying, "Why? Why are you doing this to me? Why are you doing this to me?"
If this is a hospital, why are you locking the doors?
This is about making money at the expense of vulnerable people in our society.
It's one of the most barbaric treatments that the world has ever known.
I don't remember anything anymore. It's too late.
If I ask you what is ECT or electroconvulsive therapy, what do you say?
I have no idea.
I don't know. I have no clue.
I don't know.
I don't know the acronym, but I'm assuming you're talking about like electroshock therapy.
I think I've seen it in movies.
It's a pretty bad reputation, and it's generally frowned upon nowadays.
Outdated. I don't think they really use that anymore.
It is considered an antiquated technique.
Barbaric.
Brutal.
Some say it was extremely traumatizing.
Did you know they're still doing electroshock?
I really did not know that this was actually still happening.
Oh, they're still doing it? Why?
I can't believe that it's still allowed.
I thought it was against the law.
Of all of psychiatry's inhumane practices, one of the most cruel and barbaric is electroconvulsive therapy.
People often ask, what is electroshock? And what it is electrocution. That's all it is. They don't call it electrocution. They call it electroconvulsive therapy because it has a magic three-letter acronym, ECT. And the one thing it isn't is therapy.
ECT involves applying electrodes to a patient's scalp and then passing an electrical current through the skull and the brain tissue in order to induce a seizure.
Psychiatrists shoot up to 460 volts of raw electricity through the skull to deliberately create a seizure that can last up to half an hour.
It is ultimately imparting large amounts of electricity, many times the voltage you would get even if you stuck your finger into a light socket.
In fact, ECT uses enough voltage to run 2 elevators, drive a shipping crane, or power 5 stadium lights.
This is an electroconvulsive therapy machine, also called a shock machine. The purpose of this instrument is to run an electric current through the head of a patient. These are the 2 electrodes. The machine applies a voltage to these 2 electrodes, and that causes a current to flow through the patient's brain, and that constitutes the treatment. So if we set this dial to 100%, then this instrument is set to pass 3 billion electrons through the patient's head during one treatment.
ECT machines generate nearly 430 times the electrical current of a stun gun. The machines themselves are quite basic. They pull electricity into a capacitor, an energy-storing device that allows the machine to hold over 4 times what a wall socket can deliver. At the push of a button, psychiatrists shoot this massive payload of high-voltage electricity directly through the skull. The brain, however, is an extremely delicate instrument, made up of approximately 100 billion neurons. It interprets and relays countless signals necessary for control of the body, more than 5 trillion signals per second. The brain is powered by less than 0.2 of a volt of electricity. That's nearly 8 times less than a watch battery. Compare that to the potential voltage shot through the brain in a single shock treatment. 2,300 times the electricity the brain uses to function. It's as forceful as being punched in the face by a prize fighter.
And the outcome of that is it destroys brain cells. And the more brain cells you destroy, in theory, the better it is for the person. The biggest mystery of all is why on earth people think that putting bolts of electricity through people's heads is a good idea.
Psychiatrists shock patients to create what they call a therapeutic seizure. But there's no such thing.
When we're in emergency departments and someone comes in with a seizure, that is a bona fide emergency, and we hop right to and try to stop the seizure immediately and its side effects and the things that it causes.
A seizure is a sudden electrical discharge in the brain, causing alterations in behavior, sensation, or consciousness. Seizures can be the result of a medical condition, like epilepsy, or caused by outside forces.
There are seizures that are fever-induced, or if it's alcohol withdrawn, or if it is caused by hallucinogens or by cocaine or methamphetamine. Those things, when the patient stops using them, they improve.
But in ECT, psychiatrists produce seizures in their most serious form. These are called grand mal seizures, and they are caused by abnormal electrical activity throughout the entire brain.
Okay, grand mal seizure is when you go unconscious and have a lot of spasmodic muscular contractions which can hurt you, and you lose control of your bladder and bowels.
They could stop breathing, they could bite their tongue, arch their back to such an extent as to cause a fracture of the spine. It's just a complete disorganization of neurologic function where a person has no control over their body.
The more seizures a person has, the more potential there is for cognitive decline, different neurologic dysfunctions, and more seizures.
Having recurrent seizures potentially reduces the lifespan of that individual. It has an impact on mortality.
Each year, 45,000 Americans die from seizures, as many as die in traffic accidents.
You know, mainstream physicians go to great lengths to prevent seizures. Epilepsy, seizure disorder, is a medical problem that we give medication for in order to prevent any seizures, not just some seizures. The idea is to prevent seizures, to prevent brain damage, because it's recognized that seizure activity promotes brain damage.
Yet this is what shock doctors claim is therapeutic. And so they cause grand mal seizures on purpose.
I became part of the Citizens Commission on Human Rights, which is an international watchdog investigating psychiatric abuses, because I've had shock treatment. I know the damage that it caused. I know what damage it did, not just to me, but to my family who had to get me through that. You know, when I was very young, I felt depressed, but what I didn't know is that I actually had an underactive thyroid. I was sent to a psychiatrist by my GP, and he said, well, you need shock treatment. The shock is like a grenade going off in the body. The violence of this, it's like every nerve and every cell is being electrified and with such force. And you come out of it and you know that that body is never going to be the same again. When I woke up, I was so disjointed. I didn't know where I was. I was in an incredible amount of pain. And I looked at this person standing next to my bed, and I didn't know who it was. I said, well, who are you? And she said, I'm your mother. Electroshock is torture being passed off as therapy. It is a betrayal.
How do psychiatrists get away with this barbaric treatment? Their history is littered with them.